Ethic, ethics help guide nurses when dealing with patients' privacy, communication, safety concerns, and patients' rights. Following ethical principles helps nurses provide better care while staying professional. Important ethical principles: autonomy, which is respecting patients' choices; beneficence, doing what is best for the patients; non-maleficence, avoiding harm; justice, treating patients fairly; and fidelity, keeping promises and building trust. Ethical dilemma: patients' confidentiality versus family requests. So a scenario, for example, is a patient tells a nurse they do not want their health information shared with family members. Later, a family member asks the nurse for updates about the patient's conditions. Why this is an ethical dilemma. Nurses want to assist families in response to questions. Patients still have the right to privacy. Family members may become upset when information is not shared. Nurses must balance compassion with professional responsibilities. Connections to PN practice. Practical nurses often communicate with both patients and families, so situations involving confidentiality happens often. Understanding privacy rules, workplace policies, and ethical principles help nurses protect patients' information while staying professional and respectful. Ethical principles involve confidentiality, patient's autonomy, professional responsibility, beneficence.
And some common ethical dilemmas, which is patient confidentiality versus family requests for information. In regards to the family dynamics, family members often feel entitled to loved ones' information, especially when the patient is elderly, critically ill, or impaired. Now, the HIPAA and legal obligations, PNs and nurses in general are legally bound to HIPAA to protect patient privacy, even from immediate family, unless the patient grants explicit written consent. And also emotional pressure. The nurses frequently face emotional pressure and urgency from anxious family members, making it one of the most reoccurring ethical tensions in daily practice. And why this creates an ethical conflict is because patient autonomy, the patient has the right to control who accesses their health information. Sharing without consent, even with family, violates their rights. Non-maleficence, disclosing confidential information without consent can cause severe harm, emotional distress, or can even endanger the patient's safety. Beneficence, family may need to improve family may need info to provide care to make informed decisions on a patient's behalf. Withholding this information can prevent them from supporting the recovery of the patient. And lastly, privacy and confidentiality. HIPAA and nursing standards require PNs and nurses to keep confidentiality legally and ethically unless the patient provides authorization.
Documentation and ethical protections. Why documentation matters. Documentation is an ethical and legal responsibility for practical nurses. Accurate charting support patient safety, improve communication, and provides legal protection when care decisions are questions. Good documentation should be accurate, objective, timely, and complete. Example of documentation: for poor documentation, patients look terrible. A better documentation will be patient report pain level 8/10 and grimace doing movement. Connection to PN practice. Practical nursing document patient information daily. Clear and objective charting helps improve patient safety and improve healthcare workers legally and ethically. Scope of practice. The responsibility of a PN nurse is to follow the Nurse Practice Act, stay within the PN scope of practice, ask questions when unsure, report concern quickly, work with RNs and other healthcare providers. Risk for working outside your scope is going to be patient harm, legal consequences, disciplinary action, and loss of suspension of your license. license. Connection for a PN practice, PN must understand their responsibility and limitation. Staying within scope helps provide safe care and reduce the risk of mistakes or legal problems. Evidence-based strategy for ethical decision making. The steps for ethical decision is identify the problem, gather information, review policies and laws, talk with your supervisor or the healthcare team, document action taken, and evaluate the result. For helpful resources, you will need to use the ethical principle, facility policy and procedures, Nurses Practice Act, and healthcare team support. Connection for PN practice. PNs face ethical situation regularly. Following a step-by-step process can help nurses make sure ethical and professional decisions. And then key takeaways, important points to remember. Ethical issue happen often in the healthcare team. Legal boundaries guides nursing decision. Documentation protects patient and nurses. Staying within scope improve patient safety. Teamwork and communication are important. And the references that we used for the project was American Journal of Critical Care, Nevada State University School of Nursing, Purdue Global, and the Haddad Geiger.
Again, great information. This is not anything that this is, I know this is an assignment, but these are real things that you'll be faced with. So hopefully you're taking heed to some of the solutions and ideas that your team coworkers are providing. Something as simple as family members, they make that phone call or they approach you face to face. Can you give me an update on my mom or my dad? You know, we have to step back and see, can we give them? What information can we give them? You know, who can we give that information to? And so, that's when you rely on your team, the social worker, the healthcare provider, even that patient. For the most part, when they come into facilities, they ask, can we share your information? Do you have a living will? Do you have all of these legal documents? So it's going to be really important that those things, if they do have those documents, that is shared, that we can easily get to them and is notated. But a lot of times facilities have an easy way to notate that patients have these documents because there's more that will not have the documents. And so, but either way, this is something real, you all. So hopefully you're taking heed. I know it's just an assignment, but these are real things that you'll be faced with. So again, did really, really good group you all were. It was engaging, thought-provoking, and again, realistic. All right, 2 groups left. Who shall it be?
We could go.
Okay, we'll yield to you all.
Okay.
We got PNs and shared governance. What is shared governance? It's a collaborative leadership model that empowers nurses to participate directly in the decision making about policies, practices, and workflow. This shifts from a top-down management to a team-driven style and collaborate with interdisciplinary teams to address patients' care concerns.
Then we have principles of shared governance. First is partnership, collaborative relationship among staff and leadership to build trust. Second, equity. No single rule is important than other. This ensures every member's ability is valued and used in the care process. Then accountability. This is the core belief that involves a willingness to take responsibility for the decision and the outcome related to your role. Then we have ownership, personal commitment of each individual to take part in organization success as it's their own success. Then we have transparency, information, decisions, process, and processes are openly communicated. Transparency builds trust and support informed participation. Then the last one is collaboration. Teams work collectively across discipline or department to solve problems and improve outcomes.
Sorry, I can't see. Lord. Unit-based councils. LPNs sit on councils to discuss unit issues. For example, organizing supply rooms, revisiting patient education materials, and improving workflow, practicing policy committees, make or review policies or procedures and documentation standards to make sure they reflect sensible bedside care. I'm sorry, it's really small, y'all. Thank you.
Mm-hmm.
QI teams take part in audits addressing safety issues, for example, fall reduction, reducing hospital acquired pressure injuries, scheduling and staffing councils, self scheduling, or float pools.
Contributing to care through organizational understanding. Understanding the business side of healthcare helps practical nurses align their clinical roles with the organization goals, leading to better quality of care.
Understanding organizations' decision making. Number one, bridging top down and bottom up. Understanding how decisions are made can move their feedback through the proper channels. For example, bringing staffing issues to the peer advisory council versus complaining. Two would be improv efficiency. Understanding how policies are set can help PNs name outdated protocols and suggest more efficient and effective protocols based on evidence-based practices. Three, enhanced buy-in, which is understanding rationales behind certain changes or modifications that will more than likely allow the PN to support the change and help others support as well. Number four would be impact on quality care. A strong commitment to quality care ensures that healthcare delivery remains effective and patient-centered.
Reimbursement models. Could you make it big for me too, please? Thank you. Dictate how providers are paid, shifting from volume-based fee for service to value-based quality outcome approaches. Um, key healthcare key healthcare reimbursement models. Number one, fee for service. Providers are paid for each service. While this is simple, this can cause healthcare facilities to focus on the number of services performed versus the quality of the actual care. Number two, value-based care. Shift to paying for patient outcomes and quality of care versus quantity of service. Examples, reducing hospital readmissions and preventing infections can improve reimbursement. And number three is capitation, fixed prepaid amount for patient for a set period, no matter if they seek care or not. This encourages preventative care, shifting the financial risk for the providers.
Then we have key healthcare reimbursement model. Number one is bundle payments, episode-based. A single comprehensive payment covers all services for specific treatment or condition. This promotes collaboration. For example, surgery that includes pre-op or post-op care. Then payment for performance. Hospitals and providers receive incentives or penalties based on certain benchmarks.
Can you make it a little bigger?
Mm-hmm.
Lord. That might be might be too big.
I can read it.
Okay, I'm sorry.
No, you're fine. Understanding reimbursement models, value-based care. PNs understand payments are increasingly being tied to quality of care metrics. This motivates LPNs to focus on treating the issue to avoid readmissions and improve patient satisfaction. Resource stewardship, knowing excessive waste affects budgeting. LPNs assist with effective care by improving supply management. Example, organizing carts to ensure items are used before expiration. Accurate documentation. PNs understand detailed documentation affects reimbursement directly. This ensures facility is correctly compensated. Example, coding patients. And yeah, that's it.
All right. Another great presentation. Again, these things are real. The facilities aren't properly reimbursed. Facilities go out of business. Hospitals are not exempt from long-term care facilities, doctor's offices, those they are not exempt from going out of business. So it's going to be really important that we communicate with those that are on the team, that shared governance. Something as simple as if the call light, if the cord is broken or the light is not responding, it can make the difference with us, that facility getting reimbursed for that fall or not. So if we need to alert the environmental services or whatever they call them, in different settings, they call them different things, but the people that fix stuff, generally we don't have a toolkit to fix those type of things, but we probably can. But we want to call on that team member that can specifically fix those things. So nothing is too small or too large. So we don't want to take anything for granted. Reach out to whomever, because it is a shared government, and we don't want those facilities to go out of business. We do want to provide the best care for our patients. All right. Who's next? Are we down to the last group? We're yielding to you all.
Yaddle.
Yes. I think Nancy's doing it.
Oh,
I can
Nancy.
see if I can share it.
I'm about to see. I'm about to say I'm about to see if I can do it from my phone. I'm gonna go up under where I posted and see if I can download it to my phone.
What?
Let me. So I'm there, but it's not letting me share it. Yeah, they can hear you.
Did you hit
You
more?
can't share it?
I'm on my phone.
Girl, where's your computer?
Y'all can send it to
I left
somebody. Oh,
my
there you go.
charger
There you go,
at
Nancy.
school.
You
Nancy
go,
got it.
Nancy.
Nancy got it. Nancy got it. Thank you, God.
I'm there.
All right, go down and just click. I mean, just click it like that, and then press the download, and they should let it pop up, and we can look at it like a
It's
PDF. We
already
don't.
there.
No, don't resubmit nothing.
Oh no, it took me there. I'm sorry.
Oh yeah, no, I ain't want you to get a zero.
Oh girl, I ain't
Just
getting no
click on it.
zero.
Yeah, it's right there. Yeah.
Right
Are we
there,
there?
boom shakalaka.
I'm there?
Yeah.
It's up there.
Yeah.
Okay. So we are the leadership and delegation in nursing. Myself, I'm Nancy, Kenyatta, Frenzia, Shankia, and Zanaya. And on our first slide, I'll be talking about what is leadership in nursing? Nursing leadership is the ability to guide, support, and influence healthcare staff to provide quality patient care. Effective nursing leadership helps create a positive work environment. They encourage professional growth and also as a role model for other healthcare team members. Important skills are communication. You want to have that because if you don't communicate with your team members, how will you know if anything is being effective or getting done? You want to be in touch with your team or with your team members because we're going to be like a teamwork. The CNA will have a job, the LPN will have a job, the RN will have a job. So it's a teamwork, it's a team building experience where everybody comes together and do a collective thing, and that's to take care of the patients, make sure the patients are taken care of. You want to be a critical thinker because you want to make sure that when things happen, you don't just go fly off the handle because that doesn't get things solved. And then why is leadership important? This also improves patient safety and helps healthcare teams to work together effectively.
Okay. Characteristics of an effective nurse leader. Effective nurse leader demonstrates professionalism, integrity, and confidence in their daily practice. The communi- the communicate the communication clearly, they communicate clearly with patients and healthcare team members to promote safe and effective care for the patients. Strong nurse leadership also encourages collaborations and create a positive work environment. Leadership traits, adaptability. In order to be an effective nurse leader, you have to be able to adapt to different things, not just with the patients, but with family members, situations, and your staff. And emotional intelligence, you have to be emotional intelligent, in order to be an effective nurse leader. You have to have your emotions in check when things are going, chaotic on the floor. You have to have, emotional stability and intelligence to be able to problem solve and lead the staff into, or the patient and what's going on. You have to have problem solving skills. There's problems that are going to come up every day, all day long. You have to be able to have that skill to be an effective nurse leader, not just for the patient, but the family, the doctors, the staff, all of that together. If you don't have good problem solving skills, you're just going to have a chaotic floor, and that is not good for the patient nor the staff. Time management. In order to be an effective nurse leader, you have to have time management because you only have about maybe 8 hours, maybe 12 hours to get what needs to be done. I believe in what you can do today, don't put out to tomorrow. So time management goes along with that. And conflict resolutions. You have to be able to work well in conflict, and not only work well in conflict, but you have to be able to resolve it collectively. That way, everybody is been treated fair. The residents, the staff. You have to make sure that you're doing what's best for the whole operation. And so that is my part.
Benefits and challenge of delegation.
Hold on, wait.
Oh,
Yeah, delegation.
wait.
Del-
Oh, go ahead.
Delegation in nursing. Delegation is the process of assigning appropriate tasks to quality healthcare team members while maintaining accountability for patient care. The nurse ensures delegation tasks match the skills and training. Proper delegation helps improve patient care and efficiency. The five rights of delegation: right task, right circumstances, right person, right direction and communication, right supervision and elevation. Delegation has saved time and improved workflow in the healthcare team.
Benefits and challenge of delegation. For benefits, delegation saves time and improves workflow within the healthcare team. It allows registered nurses to focus on more complex patient care needs. Effective delegation also promotes teamwork, trust, and collaboration. For challenges, poor communication and unclear instructions in healthcare can lead to many mistakes and patient safety concerns. Lack of supervision may result in tasks being completed incorrectly. It is important that the nurse does not delegate tasks that are beyond the team member's scope of practice. For nurse responsibilities, the nurse is responsible for ensuring patient safety when delegating tasks. Clear instructions, follow up, and supervisions are necessary to achieve a positive and effective outcome.
These are our conclusions and references. Leadership and delegations are essential in nursing practice. Strong leadership supports teamwork, communication, and quality patient care. So basically, that's just saying if you want to be, any job, you need to have good leadership and delegation roles, because you don't want to be just out of the world, not understanding what's going on or anything like that. While proper delegation improves efficiency while maintaining patient safety by following delegation guidelines and providing supervision, nurses can achieve better patient outcomes and a stronger healthcare team. With that, basically, if you're gonna be a leader, you need to know how to lead. You can't be having favoritism or anything like that. You need to know this is the plan. You gotta be headstrong. You kind of gotta be more involved than anyone else. It just but in delegation, you just gotta understand what comes first, what's more important, and you have to understand how to choose your battles. Like if you have a smaller case, you do those last. If you have a bigger case, you do those first, or however you feel is necessary. And these are the references we used for our presentation.
All right, great presentation. Now, I did. Students have always said that delegation is heavy on your NCLEX as well as your HESI. I don't know. This is just what they've said, the information they've left. So make sure you understand that delegation and being able to critically think, which is what that group pulled out. So great information, all real. I know you did it for a grade, but these things that you all have talked about is real, and you probably have seen some of these things if you as you rotated through your clinicals anyways, and especially if you're already working in healthcare. But nevertheless, great presentations. And so we will pause and take a break. So return at 6:45. Yeah, 6:45. Remember, this thing does still play, so turn your cameras off and make sure you're on mute. See you at 6:45. All righty. So again, great presentations. And so let's move on with our HESI information. So as we look at our HESI, some sample questions, draw back up on, that foundational knowledge. You all just talked about critical thinking. You just talked about that shared governance. And so test taking tips. Make sure that you read through the actual question carefully. And then identify what that subject or that concept is. I'm trying to share my screen here. And then answer the question regarding what the question is really asking you. Sometimes we'll jump to the answer choices first, and then that will get our focus out of focus. So just make sure that you're reading that question carefully and identifying what the concept of the subject is. Pick out any keywords, but all, if it's asking you, what's another way they put it? A lot of times it does not say priority. Which patient will we take care of first? So there's no need to think that we're not going to take care of all of the patients, but just remember when it asks which one first, they're asking you for, to think critically and priority, ABCs. And let me just stop sharing real quick. Let me go back to those slides just so that we can refresh on those real quick. Okay, let's look at these. So remember Maslow, hierarchy of needs. Let me share again. Okay, so you want to identify the question type and the topic or the concept or the subject. And then just draw upon what you know about it. It's rare that you all don't know the information. It's just that you really are just not organizing your thoughts. But what do you know about it? And then look at what's there. Is it, something physical? Do we need to be assessing something? Are they asking us to implement something or to, things that should be further assessed? Maslow, remember, he says that, food, water, shelter, then we go up from there. So if airway, breathing, and circulation and safety, remember, safety is one of those key things as well. You always want to be thinking about safety. And then look at step 4. Is this patient stable or unstable? Is this a potential risk or is this real? For example, has this person actually fallen or we have just identified their risk for falling? Do they have an actual opening on the skin so that skin is impaired, or they're at risk for impaired skin integrity? Is this expected? Draw back up on med-surg, your AP, A&P. If they're talking about a particular disease process, is this expected for this disease process, or is this unexpected? Chronic versus acute, has it been going on for a while, or is this a new change or a new finding for your person? And then what are those expected outcomes? Okay. And you can kind of like just imagine the scenario. If you have 4 patients, just look at them and just kind of give that visual if that helps you. Consider what you have learned for the normal and then gauge it. Look at what the scenario is presenting to you. Is this abnormal? Then you also want to consider the time. Is this 3 months post-op or is this 3 hours post-op? The person may still have some pain or difficulty moving around, but it's going to be different if they're just 3 hours or 2 hours post-op versus 3 months post-op. So consider that as well. Draw back up on your peds. Is it an adult or is it a pediatric patient? Is it a school nurse setting? So just bring back on all those different tips in ways that those test taking tips that you have occurred across time, and just move forward with that. We talked about Maslow's hierarchy of needs. And this is just another way of looking at it. Airway, breathing, circulation. Consider pain. Airway, breathing, circulation, and safety. Keep the client safe. And you can sum it all up. You can say who's going to pass away first if you're having to select priority. Okay. And then always think about safety. This just is another way of looking at it, expected versus unexpected. It's going to ask you what's the best action. Usually when it asks you that, we probably can complete all of the answer choices or the interventions listed, but it's asking you which one is going to be the best or first or priority, which one we should give consideration to actually doing. So we can start here. Then we'll toggle back and forth. I think we made it through this one. I think we made it through those. Okay. So just you can just put it in the chat, 1, 2, 3, or 4. The practical nurse is emptying a client's urinary bedside drainage unit. Which component of the nursing process is the PN using? Every now and then you will get a question that specifically asks you about a definition. And this is really what this is. But and then it won't, in order to know the definition, in order to identify the correct answer, you have to understand what that concept is. So you have to know what analysis is. Think about that. That's where we're pulling all this information. That's our subjective, objective. That's where we're looking in the charts. That's where the patient is giving us, we're doing that health history. We're asking those focused questions. Does that match what the question is saying? The practical nurse is emptying a client's urinary bedside drainage unit. If it doesn't match, then don't even consider that as being an answer. So, doing evaluation, we're trying to look and see, did this do any good? Did the intervention that we implemented, did it work or not? Does this match the scenario there? The practical nurse is emptying the client's urinary bedside drainage. We are assessing, we're gathering information. Implementation, that is the doing part. So does that match what the scenario is? Let's see, how did you do? So yes, so that was the way that you can look at the questions and the answers. If it does not match, and another way you can look at it, if you don't like the word match or doesn't match, you can say, is this correct or incorrect, or is this true or false? However, whichever verbiage you like. All right, so let me move us over here out of the way. So who do we see first? So we'll give you about a minute and a half to read through. So in the chat, you can just put 1, 2, 3, or 4. We have Harry, Naomi, Peter, and Pam. Who do we see first? Let me set my little timer here. And you can just drop a number in the chat. So remember those test taking tips and things we just discussed. ABCs, safety, expected versus unexpected, acute versus chronic, who's going to pass away first. 10 more seconds. Okay, and here we go. Okay, why did we not choose Pam?
Because that's expected with liver failure. You're gonna be jaundiced and you're gonna be confused.
Exactly. So you can do it the opposite. If you're trying to determine, if you get stuck between 2 answers or even 3, talk your way through it. Say, hey, this saying liver failure, and these are the signs and symptoms. Does that match, or is that expected or unexpected? So you can do process elimination as well for that. So what was so urgent about, why would we see Naomi first?
I see 102.7.
Yeah,
That's
102.
infection.
Mm-hmm. Yeah, that fever. Now the pain, but for sure that fever.
Mm-hmm.
All right, here we go. What are the most common reasons that a new grad loses his or her license? Failure to notice, failure to act or respond or report. If you're on the other end, whether or not facilities use all different types of methods of the radiology department contacting you, the laboratory department contacting the nurse, whether or not it's over the phone or if it's electronic. But nevertheless, if you're the one on the receiving end, most of the time when they're contacting you is not saying that the results are normal. Most of the time, if they're doing an extra step in actually contacting you, it means that something's abnormal and it's going to require an action. So it's not good enough to just document, hey, receive information from, Mary in the lab, receive information from Mary in the radiology department about the broken arm. It's not good enough just to document that, but what are your next steps? Did we report it to anybody? We even talked about early on a couple of weeks back, if we contact a healthcare provider and they're not responding, still we can't stop there. We report it to our charge nurse. So find out what your facility's technique is or their procedure is specifically about, how do you respond? Especially if you're going to change up roles. For example, like in a long-term care facility, you can be the charge nurse one day or one week and the next week you might not be. So especially if it's role specific in who's receiving this information, because if you're that person that day, it's going to be your duty. We don't want to breach our duty and even failing to respond or report something. You all did a real good job on the principal ethics. So negligence, remember these 4 pieces. Whose responsibility was it? Did the care plan say that it needed, 2 people? Did it say that the nurse would report signs and symptoms of infection? And then did we not do what that was supposed to be done? The patient sustained injuries or some type of harm. And if there's a direct cause, if they can relate it back, the injury or harm that the patient received, they can relate it to the nurse not performing, breaching the duty, then that means we have been negligent. Okay. All right. So let's look at Mrs. Stone here. Give you a minute, 2 minutes to read through. And then just kind of jot down on your paper what your concerns are and 3 things you can delegate to the nursing assistant. And think about why. Let me get my little timer here. Here you go. All righty, let's see what you got listed on your paper as concerns. Okay. Okay. Why is this temperature? Why is this temperature of 99.9 of concern?
Is it because she has that cavity?
Yeah, some signs of infection.
It's an indication of infection.
Yeah.
Something's going on.
I thought fever was like 101 point something though, or 100.3 or something like that.
But it's kind of like a low grade.
It's like a low grade.
It may be a change because it said afebrile for 24 hours, but this morning it states a change in
Yeah,
temperature.
it's been a change.
That's
It
why.
doesn't necessarily mean infection, but it's stating that she was not having a high grade, but now it's kind of like creeping up. That's why I think
It said she was afebrile for 24
4
hours,
hours.
but this morning her temperature is 99.9.
Yeah, that's
So that's a
borderline.
change. It's a change in it.
Changing, yeah,
So it's going up instead of down.
correct.
Okay. So even the little small change, clearly the baseline, no fever at all, afebrile, nothing. So this morning is kind of itching up. So then if we just had this alone, but we don't have this alone, we have that she had a urinary catheter that was placed 4 days ago. She's already on antibiotics. She's receiving steroids, and then she's recovering from pneumonia. So yes, this temperature being low grade, yes, would be of concern because our baseline was she was febrile for 24 hours ago. All right. What did you have for delegation for your nursing assistant?
Cleaning the tube and emptying the bag, the Foley catheter.
Vital
Okay.
signs.
Mm-hmm. Okay. All right. So she was pretty much stable because she has been febrile and so so things that we don't delegate, you all, we communication to the doctor, going in to do an assessment to gather information, that reinforcing education, medication administration, and for sure no steroid techniques. We're not delegating any of those things. So go back to your 5 rights of delegation. One of your groups that presented, they did a good job on that visual of listing those 5 tasks there. Okay, so what are some areas of education that LPN should reinforce? So let's go back to A&P. What body system is this mostly affecting? And which organ?
The lungs.
Okay, so that respiratory system, that the lungs are the organs. What does the respiratory system do for us? It's our gas exchange. So if someone has a disease process going on with the respiratory system, more than likely it's going to be something going on with that gas exchange. It's not going to be occurring like it should. So what information are we giving this patient? All things respiratory, coughing, deep breaths, frequent rest breaks. They might be having trouble breathing with this pneumonia. Just depends on how much infection is actually in those lungs. So you do want to encourage them to take rest breaks. Seems simple, but it could lead to a person falling or not falling. So you encourage the client, hey, take rest breaks if you need to, because I know you're recovering from pneumonia. You can't catch your breath like you normally would. So yes, it's okay to just stop for a moment, catch your breath. Use of incidence barometer, virus transmission, making sure if they have signs posted outside the door, making sure that we're abiding by whatever those precautions are. And then taking the medication as described, and then drinking those plenty of fluids, getting that infection and everything moving. So these are our delegation rights. Ensuring that we have the correct person. You know, in facilities, there are sometimes different levels of people on different levels. So make sure that you're selecting a person that they've been checked off on, that's saying, hey, yes, they can actually perform the task or duty that you're asking them. Just because everybody has the same description on their name tag, they still may be in different levels. One may be a new oncoming person, they may still be in training, and one may have been there for a while and have been checked off on everything. And then also the other piece of that is sometimes those competencies are redone every so often. And this person may have passed last time, but they have failed this time to perform that task or duty complete and correct. So that person may have that task, they may cannot perform that task. Is what I'm trying to say. So ensure that you have a correct person, making sure that the patient is stable and that we're communicating the correct directions and instructions for that person. And then you want to give opportunity for that person to, ask questions just to verify, what you've communicated to them, that they actually received it correctly. Because, we have that sender and receiver. And sometimes there is there are mistakes in what was actually communicated. Ensure that, and don't, just because we delegated, remember, we are not relieved of actually the task. All right, so you're gonna need a little bit more time on this one. So this one says, which of these assessment findings indicate a positive expected response in a 35-year-old recovering from pneumonia? So on your paper, just jot down the numbers. Okay, we put the timer on. You're probably gonna need about 2.5 minutes to just read through. So let me go on mute here. Hold on one moment. I'm gonna share just a moment here. I was hearing something. Okay. So on your paper, just jot the numbers down, and we'll give you time here in just a moment to look at it. Okay. And start. Okay, let's see. How do we do? Okay. So, why did we not select edema changes from +3 to +4? Why did we not select this one? Number 9.
Because it's getting worse.
Exactly. The question, remember I said identify the concept of the subject. Answer what the question is asking you. So what did this question want us to pick out? Outcomes that indicated this patient was getting worse or better. Which one?
Better.
Better. So yes, so when it said expected, a positive expected response, tomato, expected positive response or better. So we will look through here and pick out answer choices that matches what this question has asked us to select. Things that indicate that this client is getting better. Okay, good. All right. A client has been taking antibiotics for 3 days to treat pyelonephritis. Which findings requires the nurse's immediate attention?
I'm gonna say.
It will be anorexia.
I'm gonna say 1.
So put it in the chat. Put your number in the chat and we'll talk about it. $30 more seconds in the chat. 1, 2, 3, or 4.
Oh, and about the delays. Yeah, it will be one.
Excuse me.
Okay. So we will address all of the signs and symptoms, but what kind of question is this? It's asking you to select what? Something that is of what?
Immediate
That is
priority.
Immediate priority. So we already know this.
That's immediate.
So yes, so the client is already, we know this client is taking antibiotics. They have
Mhm.
something going on with their kidneys. Listen to me now. They have something going on with their kidneys.
Yep.
Antibiotics, people complain of, is not absolute, but for the most part, they complain of being nauseated and not wanting to eat. A lot of times you will see the patients also having, they'll take it with some milk, or they may eat some yogurt or something else to kind of offset, or they may even be taking medication, antiemetic, because the antibiotic is making them not feel well. Then we know this client has an infection, something going on with their kidneys here. All right. And so so all these things are they expected?
Yes.
Every one of these expected? Or which
No,
ones are
one.
expected?
Not 1.
1 and 4.
Nausea are expected. And they could have a little fever because it's
Right. Yeah, it's an
it could
infection.
run a little temperature.
Taking antibiotics for 3 days. This client should not have a fever.
Right.
After 3 days. So and then it asks you for, even if they do have a low grade fever, it's still asking what's an immediate attention. So out of these signs and symptoms, which one of them requires our immediate response?
I would say 2 then.
The fever.
Oh,
Remember, we
I
just
guess
looked
I was
at.
thinking, I guess I was thinking like antibiotics, they already on an antibiotic, so they should not have a fever. You get what I'm saying? Versus like the way I get it now.
Right, yeah.
That's why I picked one because I was like, well, they're on antibiotics to treat that. But I see what you're saying. After 3 days, it should not be a option. Like
In addition to that, it
treatment.
says nurses immediate attention. Even if we took away the part that this client was taking antibiotics, it says immediate attention. This client has
Okay.
spiked a fever, you all.
Mm-hmm.
It's just the same as the other question we just
I would
asked
have
with the
picked that.
patient that had the appendicitis, that had the pain, but then they had that fever. We're
Doesn't
not just
seem
saying a
to.
low grade, it's saying this person outright has a fever. That requires our immediate attention. All right, let's keep it going. And let's give you about a minute on this and start. Just drop it in the chat, 1, 2, 3, or 4, and then you can check your answer as we move forward. Trying to get the minute pulled up. Okay, and go.
Okay, Beckham.
So don't forget I'm not on mute, you all, so I'm not sure what you're saying. 15 more seconds. All right. Let's see, how did you do? So let's go back to the question. If the nurse is questioning something, is the answer choice we are looking for. If the nurse is questioning something, the nurse would question what part of the teaching plan. If the nurse is questioning something, are we looking for an answer choice that is incorrect or correct? Or true or false?
Incorrect.
What'd you say, Ms. Nelson?
Incorrect.
Incorrect.
Incorrect. Okay. All right. So again, see what this question is asking you. What the nurse would question. We're not going to question anything that's correct. They should be calling 911, monitoring their blood pressure, monitoring their iron and hematocrit levels. But why would this patient need to be avoiding large crowds and fresh fruits and vegetables? So if we're questioning something, you're looking for an answer choice that is incorrect. So again, identify the concept. Answer what they're asking you to answer about the concept. All right, here we go again. Let's go. Let's do a minute. Put it in the chat. 1, 2, 3, or 4.
Uh-oh, we can't see it.
I'm gonna put it back up there. I was just trying to. You gotta be careful when you're not on mute. 15 more seconds. Okay. All right. Remember ABC, safety, who's going to pass away first, food, water, shelter. Just go back through those things. This question says, which findings should we be reporting immediately? Let's see. How did you do? Okay. Why did we select profuse perspiration? So come off mute and tell us, why we have selected that? Why would we need to immediately be reporting that?
Because they really shouldn't be doing. Let me see. Let me go back and make sure.
Go back to what the patient
And
has.
it's something to do with is it hypoglycemia?
Something could be going on with their blood sugar.
Yeah, like
Because they're profusely from
hypoglycemia.
sweating.
The patient has diabetes.
Yeah.
Exactly.
You have hypoglycemia.
Exactly. This is okay. We know this is not normal, but the question says report immediately. We know if someone has profuse sweating and they have diabetes. Now, we're not talking about someone that just that might have cirrhosis of the liver or something like that. Person has diabetes. We know if they're profusely perspiring, something's going on with that blood sugar. More than likely, it's going to be low. More than likely. Numbness and tingling of feet, they may have that because if their diabetes have been uncontrolled, then they do lose tendency to have that numbness and tingling in their feet. That's kind of expected. Bunyan on the left grade told you all, if you read an answer choice and you go, what does that have to do with the question? More than likely, it's just a placeholder. Don't give it any more time. Go ahead back to the base question. It's about diabetes. We're looking at signs and symptoms. Then it says something that we need to be reporting immediately. Okay. All right. So here we go. This is select all that applies. We'll give you a little bit more time on this, and we'll give you 2 minutes on this. So just write down your numbers 1, 2, 3, 4, 5. Select all that apply and start.
I can't read all that. Let's see.
So I'm gonna go ahead and ask you all to put yourself on mute if you're not responding to the answer choice. So just put yourself on mute, you all. The sessions are recorded. All right. So let's look back at the question. Uh-oh, it went too far. Okay. So we have a patient that has 78 years old. When we say consider the age, both in development, male, has Parkinson's, who has been referred to home health agency. So this patient's in their home. Okay. Then the question, now let's answer what the question is asking. So we have that scenario, but the question is saying is about delegation to unlicensed personnel. So which of these matches or that is true that a UAP can safely that you can safely delegate to the UAP? Okay, so that's how you can just break that question out. Yes, we can ask them to record the pulse and the blood pressure measurement. We can ask them to remind the client to allow adequate time for meals and assist the client with prescribed strengthening exercise. A lot of time, PT and OT, once they finish, they actually come in and evaluate the patient. They will train the unlicensed personnel, the CNAs, and the nurse on how to do the strengthening exercises, and they just sign you off on it. And that is something that the unlicensed personnel can do. But would we be asking, does it match delegation for a UAP? Is it true that the UAP should be assessing for tremors after a medication, levodopa, has been administered? That doesn't match something that's out of the scope for UAP. It doesn't match. We would not select it. Okay, so how did you do? right. So it's a delegation question that gave you all this information, but really it was a delegation question. Go back to your 5 rights of delegation. All right. Here's another select all that apply. Am I giving you all enough time to read through the questions, or do I need to add a little bit more time to it? All right.
It's
Go ahead.
good.
Okay, so here we go. And start. Select all that apply. Let me just pause you. Let me interrupt you just a moment. If the question does not specifically say select 3 answers, select 2 answers, clearly select all that apply. So when it says select all that apply, it does not mean you're just looking for 2 answers or you're just looking for 1 answer or whatever the number is. Unless the question specifically says from the following, select 2 or select 3. So select all that apply means read through, see if it matches, see if it's correct, true or false for the question that's being asked. Okay, don't hush up here and go. Okay, 10 more seconds. So we are matching. What are we matching? We're matching the scope of practice for LPN. Essentially, that's what this question is asking us. All right, let's see. How did you do? Why did we not select developing a discharge plan that includes a referral to the Epilepsy Foundation?
That's for the case manager.
That's for the case manager or the RN.
That's the RN. We can't develop, but we can implement.
What word would have made number 3 correct for the LPN? What word could we have changed out? Or what word could we have added?
Taking out developing and put implement or
Reteaching. Reteaching.
Reteaching or reinforcing. So yes.
To teach or reinforce, yeah.
So number 3, the question was, what word could we have added to number 3 for it to fall up under the LPN scope of practice? Remember, we can reinforce. So we would have added reinforce teaching.
Reinforce or
and we would have. Say that again, Ms. Park.
Could we have used instruct?
No.
Not initially. We can only reinforce.
Okay.
So yes. So good you brought that word up. So don't let it change what you know. You know your scope of practice. We reinforce teaching. So if this answer choice does not indicating that we are reinforcing what has already been taught, it doesn't match our scope of practice. So we would not select that. Okay. Just like we said that developing a discharge plan, that doesn't match something that we as an LPN can do. So we would not select that. Or if you like the word true or false, developing a discharge plan is false for our LPN scope of practice. You read each answer choice by itself. If it doesn't match or if it's not true, then we're not selecting it. Okay. All right. So here we go. And the timer is on. Okay. Which nursing activity included in the care plan is best assigned to the LPN? Again, why would we not select 3 and 4?
Because we can't teach, we can only, because that'd be the initial teaching, and 4, that would be, you
That
know,
that initial
initial
teaching
teaching.
too,
Yeah,
right?
collecting, yeah.
Yeah.
Exactly. And then here's another test taken too. We can only select one answer. 3 and 4 were essentially the same thing. So we can automatically, nevertheless, it was not in our scope of practice, but they're both the same. We can only select one answer. So we just push those to the side. So we're left with administering that nitroglycerin because it's asking us something that we can do that's in our scope of practice. All right, that's our little timer going on. Okay. All right, here we go.
So Professor Ford,
Yes.
for those, do you mind explaining for those that maybe pick number 2? Could you explain why that wouldn't be the best answer?
Which nursing activity included in the care plan is best assigned to the LPN? The LPN can do these things, but who else can collect the pulse and the blood pressure and the oxygen saturation?
UAP. CNA.
UAP. Exactly. These are for the RN. The UAP can do this one. Can the UAP administer this one? Can it administer medication?
Nope.
Nope. And it says what's best assigned to the LPN. We automatically excluded 3 and 4 because we're saying those for the RN. So we're left with 1 and 2. Best. We have a UAP and a PN standing there. We can easily delegate this to them because the UAP cannot administer medication. So the best answer choice between 1 and 2 would be for the LPN is to administer that medication. So you can use process of elimination, eliminate the, once you understand what the question is asking you, it's best. Remember, what's the other wording? Most of the time it says best, which is the best answer choice. A lot of times when you look at those answer choices, remember I said early on, you probably can implement or do several of those answer choices, but it's asking you which one is going to be best. And then what was going on with this patient? They just had a heart attack 3 days ago. They're reporting fatigue and chest discomfort. Okay, so is it expected that this client will be having this fatigue and chest discomfort? Probably so. That's probably why they already have this nitroglycerin already ordered. Okay, so think about heart attack. Some of that, go back to A&P, mid-surge. Some of the heart tissue has died. They had an acute myocardial infarction. They've had a heart attack. That what is the heart supposed to do? It's supposed to be pumping that oxygenated blood. So if it's part of it has died, part of that oxygenated blood is not getting to the brain, the baby pinky toe like it should. So of course, this person's going to feel fatigue. Part of that heart muscle has died. They're going to have that chest discomfort. So you're going to see nitroglycerin ordered for them. It's going to be a routine medication. Even once they get discharged, they may still have it ordered PRN. And some of them, they even just tell them to keep it on them for long term because that heart tissue has died, they still may feel that chest discomfort, even though they're outright not having another heart attack. So the best assigned to the LPN. Let's see what they said. They says administration of nitroglycerin and appropriate client monitoring for the therapeutic and adverse effects are included in the LPN scope of practice. Collecting the blood pressure can be delegated to the UAP. So yep, that's what we said.
Did you tell her?
Miss Trapp, if you would.
I'm sorry.
Check your mute. Okay, so let's wait a minute. We'll stop. We'll stay on track here. Let's just pause right here before going to this next question, and let's take us a 5-minute break. So return at 7:36. 7:36. Remember, this recording still plays, so turn your mute on and turn your cameras on. Mhm. All right. So again, remember, answer for multiple choice. We each answer separately. Remember that only one answer choice is correct. It's multiple choice. This is not select all that apply. What is desired outcome for the client? Remember, we want their airway, breathing, circulation to be fine. We want them to be safe. We want food, water, shelter, those things covered. And then remember what your scope of practice is. Think about words that like you all brought up, instruct, those different words, but they mean the same thing. It doesn't mean reinforce, then it's not reinforced. That's out of our scope of practice. For priority questions, all answers may be right, meaning that we can perform all of those interventions that are listed, but it's asking you which one is best when we're talking about priority. Think of it as if I can only do one of these, which is the safest and the best for this patient. All right, let's see what's over here out the way. So we have a patient with type 1 diabetes that reports feeling dizzy. What should the nurse do first? Drop it in the chat. We'll give you 45 seconds for this one. Okay, go back to what you know about type 1 diabetes. Which body system is mostly affected? Those organs. Which one are we going to do first? Is this a sign and symptom of diabetes? Think back to the other question we had. If the person would have had the profuse perspiration, but is feeling dizzy, one of those signs and symptoms of diabetes. Okay, let's see, where did you put? Huh? It's asking what should the patient do first? We got type 1 diabetes, dizzy. What should the nurse do first? Okay, we want to go ahead and check their glucose because think about those signs and symptoms that we know about diabetes. Being dizzy is usually not one of those that's common, like the profuse sweating, the intense thirst, using the bathroom, like urinating a lot. Those are expected signs and symptoms, but feeling dizzy, that's not one that's associated. So we would need to go ahead and check this patient's glucose. That profuse sweating, more than likely that sugar was going to be low because that's one of those things, those signs and symptoms that's specific, expected for someone that has that has diabetes that's out of control, either high or low. But feeling dizzy is not one of those expected signs and symptoms. So we need to see what's going on with this patient's glucose because it might not be their diabetes. Okay. All right. Here we go. Let's do a minute and about 30 seconds on this. Airway, breathing, circulation, safety. Which of these patients would pass away first if we don't go ahead and assess them? Okay, let's see. How did you do? All right. Why did we not select patient number 2?
Because that's even though it's over 100, it is still a little decent.
And they're type 2.
Exactly. They have type 2 diabetes. They have a diagnosis of type 2 diabetes.
Hmm.
Now, had they not had that diagnosis, yes, we would have looked at that number still being a little bit elevated, more than usual. But what was it about that patient that was 58 years old? What was it?
The heart rate of
The
four.
That
heart
heart
rate
rate.
below.
Now, there are some people that they say, that you all that are, really, in shape and they have those low heart rates, but still, we would need to check this person out first because that's way, way off from 60 to 100. Got it. Airway breathing and circulation. Circulation. All right. Here we go. Y'all only need a minute on this because y'all moving fast on the other ones. So here we go. Pay attention to the words, the wording, the verbiage. Tomato, tomato. But we're still saying the same thing. Okay. Let's see. How did you do? Why did we not pick patient 1 and 4?
So they just had some type of surgery.
Yeah, and then the other one has a mental status that needs assessment.
Just
Yeah.
came from the
So that's a
long-term care facility. Exactly. Both of those, they're urgent. They're critical. Exactly. They just undergone surgery. As I said, look at those keywords. Has just undergone surgery. This one right here, they just was admitted from the long-term care facility. All right. So why did we not choose number 3?
Because they need teaching
so
because they're
they
being
paying
discharged.
for discharging.
And they need teaching from the RN.
Yes. It didn't say that they need to be retaught or reinforced. Got it. Good, good, good. All right, here we go. And go. Let me pause. That was another example. If you would think of it the opposite way, if you kind of get stuck on some answer choices, would think, well, why would I not choose this? Okay, go ahead. Okay, the answers are coming in. Again, it says report immediately. Okay, let's see, how do we do? Again, that temperature, something going on. They're going to report all of these, but the question says report immediately. All right. And so why did we not choose respiratory rate lower than 18 breaths per minute?
Because that's like normal.
That's okay.
That sometimes can be
That's
normal for
60.
some
Yeah,
people.
that's closer to normal.
Exactly. So what is the normal respiratory rate for an adult? What to what?
I
Is
think
it
it's
16,
16
16
to
to
like
20?
20
Some
something.
people some books even say
21.
12 to 20. Exactly. But for sure,
Yeah.
16.
Yeah,
There's nothing
16.
wrong with that respiratory rate. So good. So again, some answer choices are just placeholders. So you go back to what you know the norm is. Even for this blood pressure, the temperature. What is the normal temperature? What is the normal blood pressure range? Got it. Good. Okay. Here we go. You probably need to think about med-surg and peds for this one. Think about it. What did we do for the patients that had varicella? So hopefully you're jotting these down on paper and or in the chat, and hopefully you're checking yourself before we give the correct answer. So make sure you're participating because it's going to help provoke that thought process. So we got a patient that have varicella, and we're trying to figure out which PPE that we need. Okay, let's see, how do we do? Okay, so remember this one is contact and airborne. So we're gonna need all of these things. Okay.
Oh, I done put 40.
What was that?
I'm sorry.
Okay. All right, let me reset my timer here and let's start reading. Mm-mm. 'Expected versus unexpected, ABCs, safety, food, water, shelter. Fifteen seconds. All right, let's see, how did you do? Why did we select, what is this dyspnea? What is that?
Not breathing.
Shortness of breath. Person has a problem with gas exchange. Exactly. It's that priority intervention. Airway, breathing, circulation, safety. Which one of these signs and symptoms would this person have at risk of dying first? If they have shortness of breath, they're at more risk of passing away. Airway, breathing, and circulation. Good. Okay, and start. I can stop giving my clues. I'm not gonna give any clues on this one. Let you think through it. All right. So which body system has to do with pertussis or the whooping cough mostly?
The lungs.
Yeah,
Okay. So the respiratory system, gas exchange, the lungs, inhale, inflate, deflate. Okay. All right. And it says first. So this is a priority question. So what's our guidance on determining what's priority? What are those three letters?
ABC.
ABCs. And then of course we add safety in there. Another way of looking at it, if a client has an issue with airway, breathing, and circulation, which one of these things can help us determine if they really do? And they said they have whooping cough, but we need to, this is the first action we need to check out. How did you do?
The O2 saturation.
You got it, because we need to see how they're really breathing. That pulse oximeter tells us what that how that gas exchange is doing. And in addition to that, it tells us what that heart rate is doing. Most of them have both of them on it. Good. All right. Put myself on mute so I won't start talking. Here we go. All right. So why did you not select answer choice B, number two? Why didn't you select number two?
Because of new onset
A
chest
new
pain.
onset.
You have to
Chest.
do an assessment, right? In the
So
disease.
even though this patient is 2 days after having his heart attack, what is it? Look for those words. New
New
onset of chest
onset.
pain. So they got a
Mhm.
new onset. So this patient is critical. This patient is unstable. Got it. All right. So why did we not choose number one?
Because of the
Because
full
it
assessment.
just was amended an hour ago and need an assessment done.
A full admission assessment. Exactly. Good, good, good. All right. Let's see. Can we get a few more
I'm
in?
so tired of goddamn clay.
And start. Okay, let's see. How do we do? So this question is about delegation from an LPN to the unlicensed personnel. Is it in the unlicensed personnel scope of practice? What are those 5 rights of delegation? Got it. Okay. All right. So you all may have some answer choices where you have to drag and drop. Same thing. Answer what is asking you to answer. If it does not match, for example, they have a column for one concept and a column for another. You drag the things that matches that first concept. You drag the things to the second column that matches that concept. Look at the answer choice independently. Again, look at each answer choice. You can turn the question into is true or false, match, does it match, correct versus incorrect, whichever verbiage you like. It is not a multiple choice question. It's simply you looking at that answer choice independently, even though they have it all stacked up there. There may be several correct answers, but drag and drop it to the correct column. Don't focus on the number of answer choices unless it specifically tells you select 2 for the column 1 and 2 for column 2. Column 2. Otherwise, just if it matches, drag and drop it there. Okay. All right. Let's reset our timer. Have another question, and this will be our last question. So we look at each answer independently. It says select all that apply. Let's go back to the question. It is asking us which tasks are appropriate for the LPN to delegate to the UAP. Can a UAP assist a stable client with baby? Can a UAP measure and record intake and output? Can a UAP assess a client complaining of chest pain? If it doesn't match, we're not selecting it. If it matches, we will select it. Can a UAP ambulate a stable post-op client for the second time that day? Can a UAP reinforce teaching about wound care? Can a UAP obtain routine vital signs on a stable client? So that's how you go back to the question and see what it's asking. Well, this question mentioned a OPN is supervising. And down here it says the OPN is delegating to the UAP. So this question is really about tasks that a UAP can complete. So let me look at each one of these independently. Does it match what a UAP can do or not? All right. So be sure to look. There are already 5 recordings for Hesi Review in the announcement section. There should be 5 more, or at least 5 more, probably more than that. So just take your time and just go through some of them, chunk it up, go back through your required readings. Like we had to pull up on Med-Surg tonight. We had to pull back on A&P. Just go back over everything, identify those areas that you're not as strong in. Start with those first. Next week is your Hesi week. So you will report to your Hesis as, they have them planned per campus. Specifically, if you have not heard from your campus dean, please reach out to them because they're campus specific. The deans oversee that process. I will see you out in week 12. Your remediation should have been completed by then. And I will let you know, I will put it in the announcement sections about meeting Tuesday because we won't meet next on that week 12 on that Wednesday because the grading would have been completed by then. But nevertheless, just look for the announcement. If there's a concern, please send a message. Take care, and we'll see you all in
Hey,
week
hold
12.
on. Can I ask a question real quick?
Sure.